Hello, and welcome to Supporting Our Members During COVID-19. I know there's a lot of information about the coronavirus that you hear every day, and it constantly changes. We understand how difficult this is for you, your family, and your community. I'm here today to give you support during these uncertain times and provide some tips to help you stay healthy. Keep in mind that this information is general in nature. It's not meant to replace the advice or care that you get from your doctor or other health professional. Aetna isn't responsible for the decisions you make based on this information. Only your medical provider can diagnose, prescribe, or give medical advice. Contact your provider first with any questions or concerns regarding your personal healthcare needs. Here are the topics we plan to cover today: tips for staying healthy, dealing with the stress of the COVID-19 pandemic, Aetna resources to help you during the COVID-19 pandemic, keeping you informed. It's a webinar packed with information and tips to help you stay healthy. So let's get started. True or false? If you Google coronavirus, you get more than 10 billion results. True. A quick Google search on March 25th yielded 10 billion, 20 million results. Most of us haven't seen anything like the current outbreak of COVID-19. There's a lot of information floating around in the news and on social media. It can be hard to tell what's true from what's not. So where can you find information you can trust? We encourage you to visit the Centers for Disease Control and Prevention, CDC, website at cdc.gov. They have a lot of information there, including frequently asked questions. You can also look to your local or state health departments. Aetna is also providing our members with information and support during this time. We'll cover more details a little later in the presentation, but here are the websites you can visit to check for up-to-date information. As always, our member services team is available to support your needs and answer any questions you may have during this challenging time. You can call us Monday through Friday, 8 a.m. to 9 p.m. Eastern Time. SHBP, call 1-866-234-3129, TTY 711. And SEHBP, call 1-866-816-3662, TTY 711. Let's go over some important tips for staying healthy during the COVID-19 pandemic. Let's start with cleaning your hands often and cleaning them well. The guideline is to wash your hands frequently with soap and warm water for at least 20 seconds. Using hand sanitizer is a good alternative if you don't have access to soap and water, but be sure to look for at least 60% alcohol. Use enough hand sanitizer to cover your hands, rubbing them together until they feel dry. Another important safety tip is to do your best not to touch your face, making a special effort to avoid touching your eyes, nose, and mouth with unwashed hands. And it's a good practice to cover your nose and mouth if you sneeze or cough. Using a tissue to cover a sneeze or cough is ideal because you can throw it away right afterwards. But if no tissue is available, use the inside of your elbow. Be sure to wash your hands or use hand sanitizer as soon afterwards as possible. Cleaning and disinfecting frequently used surfaces in your home becomes much more important when you're trying to avoid touching contaminated surfaces. Clean and disinfect surfaces that you touch often, such as faucets, countertops, tables, cell phones, and light switches. It's important to take care of you. That way, you can be there to support those in your life that may need you. So what are some of the best ways that can help you stay healthy? You can aim for 8 hours of sleep, drink plenty of fluids, eat a well-balanced diet, stay physically active. There are fun, easy ways to be active at home. We'll go over some tips on how to stay active at home later in this presentation. It's also important to reach out to your healthcare provider if you have a fever, cough, sore throat, or body aches. And be sure to separate yourself from others, including those in your household, to minimize the risk of exposing them. If you had to guess, what do you think is the best way to prevent contracting the COVID-19 virus? Since the virus is primarily spread from person to person, the CDC says the best way to prevent illness is to avoid being exposed in the first place. This means avoiding people who are sick by staying at home as much as possible and keeping your distance from others through social distancing. Do you know what's recommended when it comes to social distancing? COVID-19 mostly spreads from person to person through people who are in close contact with each other. In this case, that's within about 6 feet. The CDC is encouraging social distancing, especially if COVID-19 is present in your community. It not only protects you, but people around you. And governors in some states, such as New Jersey, have issued stay-at-home orders to help slow the spread, as well as orders to wear masks when in public. To learn about wearing a cloth face covering or creating your own mask at home, visit the CDC's website. Guidelines and regulations for social distancing and stay-at-home orders vary by state, so check with the CDC or your local health department to find out what's recommended in your area. We know that it's smart to keep our distance and give others a little more space, but you can still go outside. Just be thoughtful about it. You can spend time in your yard, eat lunch outside, take a walk, whatever you choose to do. Just try to stay 6 feet away from others that you meet. Be sure to call family or friends or write them a letter. We're social creatures by nature, and we need to feel connected. Find creative ways to reach out. We know there may be instances where you need to leave your home for essential goods or services. Many grocery stores and pharmacies are offering special hours for adults 65 or older and people of any age who have serious underlying medical conditions to limit person-to-person contact. You can also order ahead for curbside pickup or use a grocery delivery service to avoid leaving the house at all. Check with your local stores for specific hours and days of operation. Next, let's talk about how to deal with the things that are happening because of the COVID-19 pandemic, including ways to help deal with stress and anxiety. Stress is how your brain and body respond to changes. You may be worried about your health or the health of a loved one, finances, taking care of your family, how to manage life at home, other personal concerns. These are just some examples of the continued changing demands many of you experience on a day-to-day basis. When we are worried or stressed, we release a hormone called cortisol. This is what causes that fight or flight stress response you may have heard of in the past. You may notice that your heart rate increases, you breathe faster, or you have a burst of energy. This is perfectly normal. Stress affects more than just your mental health. It also affects the body in many ways. Some examples of this, such as sadness and fatigue, are shown here. Finding constructive ways to deal with stress can help you minimize or possibly even avoid these symptoms. We want to show you in these next few slides what steps you can take to help stay as healthy as possible during times of stress. It's natural to worry. A great way to manage stress is deep breathing exercises. Breathing deeply and slowly counteracts the fight or flight response in our bodies by slowing our heart rate and reversing the stress hormones that are released during times of stress. Here are the steps you can take to practice deep breathing. Lie down or sit comfortably. Close your eyes and place one hand on your belly and the other on your chest. Begin to breathe slowly and deeply through your nose. Expand your belly, chest, and lungs. Let the belly push your hand back as you breathe. Slowly breathe out through your mouth. It's important to take care of yourself during this time. For example, be mindful of becoming overwhelmed by negative information about the pandemic. Stay informed, but avoid information overload. Take breaks from the news and social media. Find time to unwind. Do activities you enjoy. Take some deep breaths. Reach out for support if you need it. Talk to friends or family, or call your healthcare provider. The CDC has resources that specifically address anxiety and stress related to COVID-19. Here are a few more tips from cdc.gov to help you stay emotionally and physically strong. Try to eat healthy, well-balanced meals. Nutrition is about more than vitamins. It also includes fiber and healthy fats. Now is a perfect time to learn simple ways to eat healthier. Exercise regularly and get plenty of sleep. Avoid alcohol and drugs. If you're a caregiver, the CDC also offers great advice on how to keep yourself safe, as well as your loved ones. The health and well-being of our members is our top priority. That's why we're offering additional support to help you stay protected. We're also committed to keeping you informed during these challenging times. Aetna is waiving member cost sharing for diagnostic testing related to COVID-19 if you meet the CDC guidelines for testing and it's requested by your doctor. This policy covers the cost of a physician-ordered test and the office, clinic, or emergency room visit that results in the order for a COVID-19 test. The test can be done by any approved lab. We will also waive member cost sharing for inpatient admissions for treatment of COVID-19 or health complications associated with COVID-19. Did you know you can see a doctor without leaving home? We can all do our part to help prevent the spread of COVID-19. Using telemedicine to see a doctor is a great option to help you take care of your health while protecting yourself and others. That's why, until further notice, we're providing you with zero copay telemedicine visits for any reason. There are 2 ways you can get care through telemedicine. With a telehealth visit, you can meet with a doctor without having to go into their office. When possible, we encourage this option to maintain care continuity. If you're interested, just contact your doctor. They'll let you know how they can see you by virtual care services, which include video conferencing and over-the-phone care. For telehealth visits, out-of-network cost share applies to members enrolled in the HMO. If you're enrolled in the PPO with Extended Service Area, ESA, there is no out-of-network cost share. You can see any provider who is eligible to receive Medicare payment and accepts your plan. A teledoc visit allows you to speak to a licensed doctor by web, phone, or mobile app. Teledoc visits are for general medical care only. If you need dermatology or behavioral health services, seek telehealth from your own doctors. You need to register for teledoc. After you register, you can schedule a session with a doctor. You can get more information or set up your account at teladoc.com/Aetna or call 1-855-TELEDOC, 1-855-835-2362, TTY 711, 7 days a week, 24 hours a day. We want you to know that we're providing you with personal support during this time too. If you have any underlying conditions that put you at greater risk for developing complications related to the coronavirus, don't worry. Our care managers will reach out to you directly. Due to coronavirus, we're now offering our in-home health assessment program through telehealth. We are now performing virtual assessments with audio and video options. This enables you to talk to a trained healthcare professional about your unique needs. During the virtual visit, you can spend up to 45 minutes with a licensed healthcare professional. Get answers to questions you may have about your health and daily activities. Receive helpful coronavirus education and best practices to stay safe. Review medications and dosages. Discuss steps you can take in your home to help increase your safety and meet your personal medical needs. For those concerned about COVID-19 and anxious about what to do, the Resources for Living program is available for all members and their families. This program offers community resource referrals, including support services in the local area, as well as in-the-moment phone support to help callers cope with the emotional impact of the COVID-19 outbreak. To help you get through this difficult time, we can help you with emotional well-being support. You can meet with a counselor online or by phone to talk about what's on your mind. We can also help with everyday needs. Our specialists can connect you with local companies that may provide services such as household cleaning, meal delivery, transportation, and medication assistance. There's no charge for the research and referral. You would pay the cost for any services you use. With Informed Healthline, you can speak to a registered nurse about health issues that are on your mind, whenever you need to. Of course, only your doctor can diagnose, prescribe, or give medical advice. But Informed Healthline nurses can provide information on more than 5,000 health topics. They may save you a trip to the ER or help you make smarter decisions about your healthcare. Plus, it's toll-free. You can call as many times as you need. It's included with your Medicare Advantage plan at no extra cost. Remember to contact your doctor first with any questions or concerns regarding your healthcare needs. We're committed to keeping you informed during these challenging times. Your secure member website is a great way to keep track of your benefits and stay connected with us. So we encourage you to follow these steps to register if you haven't already. Take a moment to read through them. After you register, be sure to agree to receive electronic communications from Aetna. You can have updates and other paper communications sent securely straight to your email. If you're already registered, be sure to check and update your contact information if needed. To sum it all up, we hope you've learned more about how you can stay healthy and safe, more about the Aetna resources and programs that can support you and your loved ones, and how to contact us for support during this time. You can read the transcript for this video and watch it again on sonj.aetnamedicare.com. Thank you for attending the webinar. We wish you and your loved ones good health.